Good afternoon, everyone. I'm Dan Blair, and in my present iteration, I'm a senior counselor and fellow at the Bipartisan Policy Center. Like a cat, I've had many past lives, and one of those was being the president and CEO of the National Academy of Public Administration, a congressionally chartered organization that had a broad interest in this topic. I ran two federal agencies, the Postal Regulatory Commission and the Office of Personnel Management. And I think what was relevant to this panel was I spent 17 years on the Hill in both the House and the Senate on the House Government Reform and Oversight Committee, as it was called at the time, and the Senate Governmental Affairs Committee. And during that time, we had a number of government reforms enacted, and it seems to me that this evidence agenda is part of that iteration. We had the CFO Act in the early 90s. We had the Government Performance and Results Act. We had Klinger-Cohen. We had FSMA, or GISMA and FSMA. We've had the GPRA iteration number 2 about 10 years ago. And it really is this progression of looking at how to improve government performance. And that's really what evidence-based decision-making is all about. So Sandy, I appreciate the invitation to be here today and the good work that you and Tim just described in the options, and the key word there is the options, that this paper presents for Congress to consider in implementing and, importantly, institutionalizing the evidence agenda as it applies to oversight and legislation. Now we're going to hear from 3 experts on the ground, who are to my left, who have real-life experience in evaluating and moving legislation, and their views on how the use of evidence can not only strengthen the legislative and oversight process, but can be institutionalized for current and future congressional use. It's my pleasure to introduce Dr. Elena Flanagan, Holly Harvey, and Ryan Martin. All 3 panelists have unique and real-world perspectives and experience in addressing the use of evidence in the oversight and legislative process. We will hear from our 3 panelists first, then begin a moderated panel discussion followed by audience questions and answers. Then we'll conclude the panel discussion with final observations by the 3 panelists. By way of background, Dr. Elena Flanagan is a Science and Technology Policy Fellow with the American Association for the Advancement of Science. Heard that referred to as the AAAS Fellowship. And Dr. Flanagan is currently placed with the U.S. Congress Joint Economic Committee and with the Democratic staff. Holly Harvey recently retired from her position as one of 2 deputies in the Budget Analysis Division. Is that acronym really bad?
Yes.
at the Congressional Budget Office. As deputy, Holly was a leader for health policy analysis at CBO during a decade of turbulent activity where she managed a team of dedicated professionals to produce independent, timely analysis to support congressional consideration of healthcare legislation. And rounding out the panel today is Ryan Martin. Ryan serves as the Senior Human Services Advisor for Senator Orrin Hatch of Utah, and Senator Hatch chairs the Senate Finance Committee. Ryan advises the committee on critical issues involving the development and advancement of legislation to reduce poverty, protecting children, improving maternal child health, and ensuring social programs achieve results. And before joining the committee in 2017, Ryan worked on a similar legislative and oversight portfolio for the House Ways and Means Committee. So why don't we begin with our panel discussions. Had the opportunity to have a phone call with the panel last week and also to kind of share some thoughts and questions with them. So you kind of know what's going to be coming, but I might throw a little curveball in there. One of the things that Sandy and Tim talked about was really institutionalizing the evidence agenda in Congress. And I know how busy staff and members are. How do you introduce this to them, and how do you educate them on the importance of the options that are presented in this paper and the overall evidence agenda? How do you make them advocates for that, or at least believers? I'll start with you, Dr. Flanagan.
Sure. So, as a fellow, I'm here more as a researcher and also to learn about the legislative process. AAAS's model is to take researchers from a variety of sciences and engineering, and place them in both congressional offices as well as executive branch offices. So this is kind of a lot of our first exposure to the legislative process, to how our research might be used. And it is two-part. Part of that is learning, how do we better get our research out there? Learning, how can we, take what we're doing in our labs, take what we're doing in our own studies, and let that be useful. So, we've seen the briefing model tends to be, kind of this form right here of we need to take our research, we need to make it really digestible, we need to, be seeing who is working on legislation that's relevant to our research. What other organizations are out there that might benefit from our research that already have relationships built that we can get our research to. So, that briefing model and a better outreach model, the research community sees that as really important.
Dr. Flanagan, is there anything particular in your background that brings this issue to your interest, and what do you think would be good to share with the audience today about that?
Sure. So from a program evaluation perspective, I think it's really important to consider the systems approach. So we have evidence, we have research, but it's really important to consider how that's used and who needs it and how they can benefit from it. We have a lot of programs out there, that we are researching their effectiveness and trying to see, is it working, is it not working, is it working, how we think it's supposed to, are there other effects? And beyond just the research on the outcome of the program, you also need to consider the people in that program, the people who are working within that program, the people who are organizing that program, and the people who make decisions about that program. So, the outreach is really part of that, of, that whole systems model of evaluating programs, of looking at the people that are involved in each step in that program.
Thank you. Ms. Harvey, what makes what gives you your unique perspective on making this or institutionalizing evidence as part of the legislative process? And if you were going to just kind of give some key points today, what would you want the audience to hear about this as we go into more questions and answers with the panel and with the audience?
Well, I love evidence, I must say. I kind of chuckle to myself a little bit when I think I did 2 tours, as we like to say at CBO, one back in the late 80s, early 90s, then I left. And in fact, I left CBO saying, darn it, I'm going to go out and help people produce the information that's needed to do cost estimates, because there's all this information I need that doesn't exist. And so I've kind of been pursuing the idea of getting the right information for policymakers to use my whole career. I would say that since that time, the amount of information that's available, and the sophistication, if you will, of the ways of analyzing data have grown exponentially, which is great on the one hand, but on the other hand, it's very hard to get a grip on what's out there. So I know myself, even though I had a whole staff, trying to understand when some new thing came along, what's the state of the evidence, what do we know, what do we not know, quickly was not that easy. So my biggest thought in terms of getting evidence to be more broadly used is to make it as easy as possible, both for members, decision makers, but importantly, I think, for staff. I'm mostly sympathetic to staff. Because granted, health is a big area, but I was only dealing with one area, and most staff, of course, are dealing with multiple areas in the portfolio, and to try to keep track of all the different things going on, I think is really difficult. And so figuring out ways to convey information on one sheet of paper with pictures where possible, and I don't mean that in a patronizing way, I mean good graphs, can convey information much more quickly, that I think, to people and help them. It's more actionable sometimes.
Ryan, do you want to I gave you a brief description of your background, but is there anything that you wanted to share with the audience on a deeper dive about what your interest is in evidence and how you would go about educating members and staff on the importance of this and incorporating it into the decision-making process when it comes to legislating and oversight.
Sure, and I can definitely talk a little bit about how Congress has done that in a few instances as well, but definitely thanks to the Bipartisan Policy Center for putting this report together. I know we meet with a lot of people who talk about we should use more evidence and we should do evidence-based policy, but having actually pen to paper and coming up with some specific ideas, you know, the longer list, the better, because then there's a menu of options that people can look at and dig into, so it's great to have that. I have to give my disclaimer that I'm sharing my own views and not speaking for Chairman Hatch or for members of the committee, although I try and divine their interests all the time and meet with them frequently to understand what their interests are. But in the summer of 2013, The Atlantic published an article that was written by a former senior Obama administration official and Bush administration official that said, quote, "Based on our rough calculations, less than $1 out of every 100 of government spending is backed by even the most basic evidence that the money is being spent wisely." And I think there's a broad bipartisan interest that we can get more for what we're spending today. You know, setting aside the sort of deficit and other type discussions, there's an understanding that we're spending various amounts across the government on all sorts of different, in my world, sort of social, you know, domestic social issues, and we can have a much better impact for those resources. And I think there's a few things that are moving in this direction that I think are really indicative of where we'll be able to go and how we've seen some progress already. The first is, outside of government, you see investors and foundations and others asking for results. They're asking for more information, they want evaluations, they want to see data. And so that's spurring along a lot of local organizations and nonprofits to do better about capturing that. It's also, technology's making it, you know, I guess if you're on the other side of the hill meeting with Facebook, this might be a concern, that it's getting much easier to gather and collect data, right? So for good or ill, but you know, it's much easier. You don't have to have a 5-year, 5 million random assignment study where you don't know for a decade what the outcomes are. I mean, you can use administrative data, you can get more real-time feedback, and so that's key. In Congress, I think you're seeing a shift, at least in my world, from authorizing programs to authorizing approaches. And I think this is a really key centerpiece here. Oftentimes the way Congress works is someone comes to testify from home state of Senator or Member X. They say, we do this great thing in this one corner of the state. And they say, that's a wonderful thing. We think everyone should do this thing, right? And that becomes the law and everyone does that. We're shifting more toward a process where there becomes agreement on an area that they would like to impact. And then the specifics of what the policy might be or the program or how it's run is left up to the state or the local agency. So just a couple of examples of that in my world. One is called the Family First Prevention Services Act, where states are going to be able to receive money to prevent kids from coming into foster care. And that law doesn't say what programs they will run. It says substance abuse, mental health, and in-home parenting supports. And there will be evidence-based programs in those areas that states can select from. So that's one example. The Maternal, Infant, and Early Childhood Home Visiting Program is another one, where HHS has developed a list of, I think, 16 programs that meet their sort of seal of approval for evidence, and states can select among those. So again, that's a desire of addressing maternal child health, addressing child abuse, but not fighting over what that solution is, agreeing instead on what the overall goal should be. And then I think the one challenge I'll close with is evaluate and then what? I think the crossroads that we're at in a lot of these cases is on extremes we've seen, I mean, I've literally seen, not since I've been here, but done research on this, looking at evidence, where there's been multiple studies done of a program showing it's not effective, and Congress has barred further evaluation of the program. We don't want to do that. On the other end, there's concern that an evaluation will show something's not effective, and it will just be cut and ended. And so I think going again back to that sort of thematic approach, instead of, if there's a focus to deal with early childhood education, when you find a program that's not successful, you just try another one. When the policy is, we're going to fund this program, and you get an evaluation back that says it doesn't work, you have this sort of existential crisis where people are worried about evaluation because they don't want to be in that point where they're stuck one way or the other.
What's always been my thought on this is when that evidence comes back it's not working, some will say, let's end it. Others will say, this is an opportunity to refine it and make it better and actually get the results that are intended by the program. And so, in looking at that, and looking at the report that we just issued, do you see any low-hanging fruit that Congress might move on that in a bipartisan manner that could be adopted? Do you see, what could be easiest in adopting? I know that Sandy was talking about earlier, wrote this down because I thought it was really important, that we wanted to create space in the legislative cycle for evidence. So did any of these options that are described in this paper capture your attention if we wanted to create that kind of space in the legislative cycle?
I can start. I can think of a couple. I actually really like the evidence fellowship idea, partly after moving from the House I spent about 7 years on the House and then just came over to the Senate. I was really surprised how many fellows and interns and things there are in the committee offices and with the members. I don't know if that's sort of just the universe I'm in on the Finance Committee or if that's more broadly, but it seems like I've been to a lot of meetings and things where there's other, and not just younger interns as well, but professional fellows who are sort of taking a sabbatical and coming and working on the Hill and learning these things. So I think, and they do add a lot of capacity to sort of take a step away from the politics, look at the details, and kind of come up with more ideas. And I've seen that, on both sides, Republican and Democrat on the Senate side. The second one, I really like the simple idea of the CBO expiring programs list. That's kind of a radar of here's some things that are upcoming, and just having that be a further year out, I think could be interesting just to get people's attention. I know this is sort of a ritualistic review of that document when it comes out, right? And so having those other things on there, I think could be really helpful.
Thank you. I'm kind of dividing this question up into two sections or two parts because I'm saying what would be low-hanging fruit, but also what would be priorities in your opinion? So Holly or Elena, do you want to comment on that? What you think might be low-hanging fruit, and then we can talk about what maybe the priorities are and what the common ground or nexus might be there.
So I think the option to establish the database of evidence-based programs is a really good one, because that's something that we've seen in legislation that already exists. So McPhee, the maternal, infant, and early childhood home visiting program, is a good example that has kind of a range of programs that we know are established and that work. And that also has the benefit of showing what is the standard of evidence that Congress would like. And as other programs are trying to meet that level or have an idea of what sort of research, if we are wanting to prove that a program is effective, or if we're wanting to highlight some of the aspects of a good program, what does that look like? How can we replicate that with some other evaluations that we're doing? So just establishing that database would be really good. And I think that with some of the with CRS, there are some existing structures, or doing that Congressional Fellows program, that would be something that's pretty easy to do with existing structures that we have.
Thank you, Holly.
Yep, I would second that point, the database thing, in part because it feeds into like my main point, which is make it easy as possible. And so if somebody's looking to say they want to add in to authorizing legislation, evidence, incentives for evidence-based stuff, then that's a model for them to go to. I think the CBO report extension, hopefully none of my current colleagues or former colleagues are here. I think that's like the lowest hanging fruit in the world. I really don't think the marginal cost is very high at all of doing that. And in fact, well, whatever. I don't have to spend a lot of time on that. But another idea that I actually really like, and that I think could over time really feed into creating this culture of evidence is the idea of the CRS, whatever it is, option 2 here, sorry, the training for congressional staff. I think there is a lot of staff turnover, although Ryan's an example of some of that turnover is just moving chairs. So, but nevertheless, kind of establishing a sort of base language and approach to the use of evidence in policymaking, particularly with entering staff, but even on an ongoing basis, I think would help make the database more useful, and would help if leadership, starts exerting pressure on those goals, then the staff have to know how to implement it. So I think a lot can be done with that, and not only sort of a one-time training, but then have it as a webinar so that when then staff actually need to use that, they can go back and look at it, or a slide deck or a toolkit. I mean, there's all this stuff that can go with training now that's not just one seminar session. and I think that could be helpful for, like I said, generating a common language. I think one of the, there is always this fear that a bad evaluation will lead to a sort of knee-jerk cancellation of a program, or that there will be a bad evaluation and nothing will happen, and so what's the point? But I think creating more, a more kind of sophisticated approach to what is evidence and what it can do for us broadly among the Congress is a good idea in terms of people are often afraid. It's like if it's not all good, they don't want to talk about it. And if it's not all absolutely perfect, randomized, controlled trial, they're afraid to put it out there. And so being transparent about where there's evidence, where there isn't, what it's useful for, and how it should be applied, and having that be a common part of discussions instead of sort of the weapon of one side or the other in a political context, I think would be really helpful.
You mentioned a key term in there, and you said weapon, and I've heard this described as, one of the things to guard against is, and I'm stealing this term from him, is the weaponization of evidence. And how do you guard against that? To me, it's like riding a bicycle without the training wheels. You can always fall, and you're always going to have that threat, but that doesn't mean that you can't ride the bicycle. So how do you, you can't prevent it, but how do you address it? How do you work that into your plan to make sure that even with that looming out there, that Congress still has the evidence and the facts and the resources necessary before it, even if it wants to make a bad decision?
Well, one person's bad decision might be another one's good decision. The idea, the only thing I can think of in terms of trying to mitigate the weaponization issue is if it's more commonly understood that we're not going to have perfect evidence and perfect information for any policy, never. Nor is any policy that's implemented ever going to work exactly as Congress anticipated. Never. Well, let's just say that. And then when someone wants to say, but it's not working perfectly, you said, yeah, it's not working perfectly. What's your idea to improve it? Like I said, that's kind of naive, but that's all I can think of.
And I think that's why I've mentioned a few times already sort of the idea of Congress agreeing upon an issue that needs to be addressed and not a policy tool to achieve it, right? Because if the agreement is like we had across the House and the Senate to reduce child abuse and neglect or reduce the number of kids in foster care, it's a little more agnostic as to what that is, and you can have something that doesn't work and still survive because you can just do something different, right? I'm a big fan, and I haven't really seen this in government programs, but of A/B testing, of saying, we're going to do this thing, let's try this version of it and this version of it and see which one ends up getting us closer to where we want to be. And then that way you're sort of building in a natural failure anyway, and so it's not a surprise to people that like all their eggs in one basket. So, it's kind of the private sector idea of, failing fast, trying lots of things. I know the Arnold Foundation has been big prior to the Coalition for Evidence-Based Policymaking, talking about how many trials there are in the private sector, whether it be drug trials or private sector business trials, and how many of those things they go through until they find something that works. And then even when something does work, it may only work for a few years, and then you need to do something different. We don't have that culture and that comfort in government, and sometimes because it is that sort of personal pet project. I don't mean that in a bad way. I just mean someone is passionate about something, they come from a background, they understand it, and they really, really want to see that happen. And so if we can, sort of like in a negotiation, if you can get away from the actual disagreement and move back to the underlying interests and try and facilitate that instead, I think you can survive some of those instances better.
Can I follow on that?
Oh, please.
Because I love this idea. I think that the other thing this avoids is picking winners and losers. One of my favorite parts of the Commission's report about evidence-based policymaking was the need for humility. which I think is very strong. I think even when you have really good, solid evidence, there's still context to that evidence that may not be applicable, certainly nationally, or may not be applicable over time. And so the idea that, you know, you've got this one and done, there's evidence, we know what works, and we're done, that's implicit if you're picking a winner, like of the array of things that have been tried in states. If you're going to pick one and make that the federal policy, I think that's probably not going to lead to as many good outcomes as letting people work within a framework of not letting them waste money on things that everybody's tried and don't work, but allowing people to figure out what will work best for what they know about on the ground.
And I think, you know, we have a few models for those in some of our program and funding structure. So the idea of promising practices, you know, the idea of, it's a little bit of that A/B testing of, you know, we have things that are established, but we have things that maybe we don't have as much evidence about them as we would like, but, you know, we're trying to build that evidence base, or, you know, we acknowledge that maybe this program works for, you know, this certain population in this certain context. But, you know, that kind of builds in a little bit of that variety while still maintaining the consensus statements that the community has said about, you know, like, we know that these are the important parts of a program, but, you know, beyond that, you might be piecing together other little elements that work better for some and not others.
One of the, looking out on the horizon and how to move these kinds of options and concepts into reality, one of the things that struck me was that Congress has created this new joint selected committee on budget and appropriations process. And can this select committee play a role in supporting consideration and or adoption of these kinds of options? And what kind of, you know, I don't know how familiar you might be with this, but is this something that actually could be a catalyst towards moving Congress in the right direction when it comes to the evidence agenda?
Defer to my fellow panelists.
I just was looking at option 1 here. It says develop a protocol for systematic evidence and program authorizing. And I think we've had some success in legislation recently in a few places creating clearinghouses, tiered evidence grants, things like that, so that it's more built into just the way the program operates. I joke a lot of times the way to make this successful is have it be the last section of every bill, right? It's not the big front page thing that's getting all the attention. It's just, this is what we do. This is the normal process. And so that's something that I've worked on a lot, is trying to make it easier to make the jump for people who want to do evidence to actually looking and saying, well, here's an example, here's an example, here's an example, so that it would just become second nature, where that timing would be aligned. And I think that couples with one of the other recommendations in here that talks about collaborating with the executive branch, where, you know, I feel like a lot of times you have these sort of two spheres moving independently, and the more you can project ahead what the needs might be and have the research shop sort of preparing things that will answer questions that legislators might have, I think the more you get in that sort of cycle of having that inform the discussions, more than just, you know, 2 weeks ahead they find out there's a markup and they have to, like, you know, everyone runs for the internet to try and find what they can find and meet with whoever they can meet with and get the answers. So, yeah.
A little bit of reality there. Well, obviously, some of the things like the biennial budgeting and stuff are ripe for consideration by the Joint Commission. What will actually happen, I don't know. I do think I don't know. Well, I don't know how. So I think more the institutional things on the bottom and potentially, you know, I suppose, I don't know if as part of the budget process people want to start putting requirements in the components of authorization bills, but theoretically they could. One of the things I thought would be kind of interesting that goes with your option 14 about maintaining sort of an evidence base. When legislation comes forward, you've got the sort of whole package of the hearings and all the evidence that has come along, which honestly I laugh about, because sadly so much over the past few years of key legislation did not have hearings and did not follow regular order. So I had a funny little idea, because some people believe if you measure it and count it, that people will pay more attention to it, of, I don't know how many of you are familiar with the congress.gov page, and when you're looking at a bill, right, then there's all these different tabs. Well, you could kind of have a tab number 1 that takes you to evidence. But I also wondered, and this is another thing for our friends at CRS to take on, whether there could be a kind of template-y sort of thing that got filled out about whether a piece of legislation, you know, had hearings, if there had been evidence made public about the policy that was being considered, and if so, you know, in what venue or whatever, something that would let you kind of give things even a score. And over time, that would build up, you know, and could add to this kind of database of how much evidence is used in policy making. And again, over time, you know, sort of start documenting whether Congress is walking the walk, if you will. And I don't know if that would be most appropriately considered as part of the Joint Commission's work, or whether that would kind of come through in some of these other ideas.
But wouldn't kind of the restoration of the regular order bring that in a natural way?
It could. It could.
With hearings and committee reports and hearing reports and that kind of documentation, you know, with the CBO report in there.
Right. Well, it could, and Ryan should speak to this also. I mean, because I spent so much of my time working on health, and in health, there are a lot of sort of program authorization bills and that sort of thing, but there's also a lot of bills that are a conglomeration of a bunch of policies. Some of those policies might have had individual hearings over time, but I think it's rare that a large healthcare bill that's got a bunch of policies that are spending money, and then often a bunch of policies that are saving money so that you come out deficit neutral, or you're hitting whatever Congress's budgetary goal is. It would be unusual if each piece of that big bill had a package that demonstrated the evidence that had been considered for that particular policy as part of congressional considerations. And that may be asking a lot of a process that moves pretty fast.
Yeah. And I think, so my prior role, I was mostly in the human services role. Now I'm part of a broader health team, and so I get to see a lot of the health discussions and things like that. And it also makes me think, and sort of making a point about finding the right balance between how much Congress is looking at evidence and using institutions and others is, you know, I don't think we want to get to the point where it's sort of like Congress is voting on each cancer drug approval, right? Mm-hmm. It's like the staff are going through the studies and they're saying like, oh, you know, was it really random? And you know, was this like intent to treat, or how was it? And, you know, going through all this sort of stuff, and then having a discussion and a vote on that. And I think there can be a danger of building up the legislative branch so much with that intent in mind, saying, okay, well, here's all the information, so go ahead and decide and do that. And so that's why I'm definitely a fan of sort of the institutions, or setting up the framework for these types of things. We've done this in legislation by creating What Works clearinghouses or other things too, where there is insight and input at the congressional level, but it's not the sort of overwhelming detail level of getting into all the different studies and trying to divine what those answers are. But sort of setting up a process where there's people that are doing that, and whether it be a CBO or a CRS or a sort of like separate quasi-legislative group. Like in some states, Washington State has the Washington State Institute for Public Policy, where they sort of task this group of saying, we want to do some juvenile justice stuff. We want to know the good stuff and the bad stuff and do more of the good stuff. And they sort of rank this Consumer Reports kind of list of like, you know, scared straight is really terrible. It costs you a bunch and kids go to jail more often kind of thing. Don't do that. And they have things at the higher level. So they can,
value.
Right, and so they can sort of look to that. And they don't have to necessarily follow that, but they can kind of quick gut check and look and say, okay, here's the list of things, more of these like things here. And they're not having to go through those individually, I think is key.
To me, it kind of comes back to the issue of capacity. And some have said, you know, Congress doesn't have the capacity anymore. I disagree with that. I think Congress has the capacity if it wants to. When it wants to, it can do it. And how would you fit institutionalizing this evidence agenda into the current capacity?
There's, I meet with people all day with, various issues they're focused on or things in the state that they're wanting to do. And unfortunately, it's rare that you find the person who can bridge the sort of outside work of what's happening local or the research that's been done and the needs at the legislative level. And a lot of times it's former staff or other folks who can kind of bridge that. We get a lot, I'll have people come in, I've been handed books before, like, here's this book on this, and it all makes sense if you read this book. And it's just like, it's not possible. DVDs, or I have, if anyone wants to come by my office sometime, I have a board game by orthopedic surgeons that you can play that, lays out the various consequences of the great things they can do. So people get creative in trying to get information to Congress, right? And so I think trying to find those translators or briefings like this or other things where you can take the sort of abstract and make it concrete. And some of that, honestly, is by pointing to existing legislation and saying, here's generally a good idea that we think is useful. Here's an example that you can look at and see. And you can talk to these people real world and understand how it worked. And so it does get easier the more there are these types of things happening in statute because there's more things to point to and read about. So I think having that sort of person in the middle is really tough. And sometimes, there's think tanks in DC that do good jobs at that. Sometimes it's just lobbyists or other folks, but that's such a key link because I'm sure any staff that are here can tell you, they'll have people come in from their state university or others and say, well, here's this 30-page report I wrote on this thing and more research is needed and we're looking at this sort of thing, right? And they're just trying to figure out, what do I do now? How do I take this and do something with it?
So I think maybe tackling that problem from the other side is like recommendation 13, creating that science and evidence ombudsman position of, saying to the scientific community, please stop sending them books. Send them material that's useful. And, that board game does sound interesting, I'm not gonna lie. But, how do we as researchers make our material digestible, and how do we have an idea of what is needed in that moment? The pace of Congress is kind of frantic, and that is one of the things that I've learned coming in is the timing of things is really important, and the timing of decision making does not align well with the timing of research. Research generation tends to be, it is slow and deliberative in an entirely different way. So having that liaison position saying, this is the best way to present materials. This is the best way to make impactful statements. And this is the kind of evidence that, this is what's going on in the policy world right now. So if we had some evidence about this particular thing, that would be great. If you have it, please bring that to us. So that position to connect researchers with Congress might ease some of the difficulty that Congress has getting information that's useful.
That just reminded me of one thing too. I think a lot of times what staff and members of Congress are looking for is directional. We've got this way and this way. Mm-hmm. It's not, well, here's this other system, and if we started from scratch, we would do this, or if we did this perfect thing, here's how it would go. Congress, even though sometimes it seems like things are, major changes are being made, it's really incremental. And so a lot of times it's taking that research and saying, it's not that it had this exact impact on this, it's saying, generally these types of things seems to be better. We've looked at this in child welfare. Programs that have this sort of mentoring component, that have peer support, other things, seem like they're producing better results. And so you can then say, okay, well, let's go more in that direction. So it is a little bit more shoot from the hip sometimes, I think, and researchers, I think, may not understand how that might be used and need to be comfortable knowing that they'll come back a year or two later and have that same discussion again about what the next steps might be.
I have a couple more questions for the panel, but I'd like to give the audience an opportunity to weigh in at this point. And with that, do we have any audience questions? And we have a couple of mics. I'm glad to see a lot of hands in the audience. So why don't we start over here with you, sir? If you could.
Hi, I'm Zach Valdez. I'm also a AAAS fellow with Elena in a Senate committee. And so I know that you mentioned capacity, and I think one of the things that I get frustrated as a PhD is the difference between messaging and science. What are they trying to accomplish? And a lot of times when they're doing messaging, they're not trying to accomplish whatever the science is trying to accomplish. They're trying to get to their agenda. And a lot of that comes back to what is evidence. And evidence is just data to support your assertion. That doesn't have to be correct data. That climate change, 98% of scientists believe that it's real. 2% of those scientists can change 40% of how people think. So when we have a consensus, there's something called data transparency. Where are you getting your data from? How many people agree with your data? And I think those are things that we need to push harder than capacity is saying, this is what the general this is science. This is how things are considered. And so I guess my question is, how do you, Elena, you can maybe answer this too, is how do you move past that frustration of saying science has already told us these things, but your messaging does not align with that? And so a lot of times it's not the lack of evidence, it's the lack of what they're trying to accomplish.
That is not a question for us.
I can jump in. I mean,
answer.
you're barred from speaking on that. No personal opinions. I mean, going back to what Sandy and Tim mentioned earlier was this idea of evidence having a seat at the table, right? I think you're right. I mean, there's going to be instances where it's not just a battle of evidence to convince the other person that their position is wrong, right? But I think there are a lot of situations where the evidence can drive the discussion that way. So it may not be 100%, but it may be 80%, right? I mean, a lot of the issues that I deal with in social services, things like that, they're bipartisan, they're bicameral, they always have been. And so evidence, I think, has a lot of potential there. There's clearly landmark, I mean, if we have various studies on gun control and, are we finally just going to convince one or the other that this is the way to go? Possibly. I mean, it may be incremental. It may be sort of snowflakes stacking up and, building a strong base where people see broadly what the research is showing. But I think in a lot of cases, it's really just making sure that evidence is at the table at all. In so many of these situations, it really can just be anecdotal or, hearings are called because some event happened and there's sort of a reactionary response. So I think just getting it to be brought more frequently into the conversation can lead to those sort of slight directional shifts that'll get us in the right place.
I actually realize I do have something to add, which is what I was talking about before about the CRS and the idea of training. I do think that it's true that in some cases people are just wed to their assertions and it doesn't matter what the rest of the world thinks. But I do think there are people that have heard those assertions and don't realize they're mere assertions, and that's where the idea of having educated consumers, at least having an awareness of what are the kinds of questions you would ask when it seems like there's very contradictory evidence out there. Well, what are some things you could ask? What's the consensus? And stuff like that. So I think that would be helpful. Us old jaded folks, ought to know better by now. But for new staff coming in who quickly play fairly instrumental roles in translating what's going on to their bosses, I think it could be helpful.
I think within that recommendation, the language around like the appropriateness of certain methodological choices kind of speaks to that of, what is evidence? What are we actually considering good evidence? And, those consensus statements that are made by the community, like they don't just arise out of, thin air. And, to kind of hit home the point of this is real, this is evidence-based, this is what the science says. So that needs to be weighed more heavily than, perhaps anecdotal. And I think, you need that, that paradigm shift, that cultural change of how are we going to weigh these things? I think that is a frustration that the scientific community feels often, is just feeling like we're saying the same thing over and over and over again and it's not being well received. And I think it will take that cultural shift to accomplish that.
All right, I'll go. You've already had one shot. I'll get back to you, though. We'll go over on this side and we'll go back to that side.
Thanks. Caitlin Gazing with the Nurse Family Partnership. And I actually had a question about kind of this presentation of data to congressional staff and this balance of the anecdotal evidence and the actual evidence we're typically faced with when trying to talk to staff members about our program. We have a whole host of evidence, and sometimes they want to hear those anecdotes. We have no problem convincing Ryan, of course, but some of the newer staffers, and I don't know if you have any just advice to some of the messaging and advocacy folks in the room on how to better message this, kind of a balance between handing them a book of evidence and handing them a story about, one family?
That's definitely something that, as a fellow, that's part of our learning is, how do we package our work better? So I am still personally learning that as well. I think that, having that ombuds position is a really great place to, put that information of how do we package better. I think the things that I've learned, like you were saying, graphs, more, very detailed, not very detailed, very concrete material that is short, that gets your point across quickly, which is something academics are not great at. And, having a better idea of what is the most important thing to get across there? And the person that you're talking to, like, what can they move? Because I think a lot of times you give this glut of information of, okay, I'm going to, tell all of this information to this one person, and 85% of that may not at all be relevant for anything they can do anything about. So, really going into those meetings and knowing, okay, this particular person handles this particular thing, and this is what they can make change on, has been, one thing that I've learned from this process so far. But I think there's plenty more to learn, and you guys are probably better at answering that.
No, I think those are all really great points. I think, from my perspective, partly why the anecdote is useful is just to visualize what you're discussing, right? Because when you come with just the evidence, it's useful to sort of understand we did these tests and here's what we understood. But for people in my position that are meeting with people and sort of hearing about these things, you need to sort of understand, okay, what are you doing? Like, okay, I walk in the door, now what? Sort of like walk me through who I meet and what I, so I can, like, virtual reality, I can put on a headset and, like, I can go around the office and I can, like, visit with the people and understand. And so I don't know if it's so much, hopefully it's not so much for the actual, like, policy making as it is just the context, just understanding what exactly you're talking about. Because, you can read a whole report about some program and still not really have a feel for who this person was that got services and what happened to them and what was the timeline and who they all worked with. So I think you can sort of use that to frame what your services are and what you're doing. And then I think you can use the data to sort of step back more broadly and say, and when you do that 100,000 times across the country, we see this kind of thing as a result.
Not to toot our own horn here at BPC, but I would urge you to look at page 5 of the report. This summary of options for improving the use of evidence. I noticed, not that I'm looking at your notes, but I am looking at your notes. Everyone has this opened up here. And this is a really good way of presenting, I think of presenting your case forward. It's on one page. It allows staff and members, anyone, the opportunity to look at it quickly, to digest it. So when you're advocating or you're putting forward your positions, be able to put in concise, easily understandable and digestible information that then you can dig deeper into. So that would always be my suggestion. In back, I'll come back to you, ma'am.
Hi, good afternoon. My name is Rebecca Sheffield. I work for the American Foundation for the Blind doing policy and research, and I have a background and a PhD in special education. So since coming to AFB, I love hearing about evidence-based policymaking, and I'm also terrified because I almost never hear anybody explain evidence of what when they're talking about this. I have evidence or I have results, and I worry that it puts all evidence on the same playing field. I've seen this with some of the What Works Clearinghouse, and especially when it comes down to putting the evidence into practice, making a decision about what's going to be done in a school district, that, well, this is evidence-based and there hasn't been research conducted on that, so this is the thing we're going to use, and no one ever asks evidence of what? Well, the evidence is that it reduces the number of kids in special education. Well, is that really a good thing for all the kids who might need special education? Anyway, it's complicated and it needs more explanation, and you only have a few minutes or a few paragraphs to explain what's going on. So I'm glad we're having this discussion. I hope that we don't oversimplify what we're talking about, and I really like the idea of making sure that we have capacity and expertise on staff in these offices to as Ryan was saying, like, understand the context around what's going on. But many questions, I'll pick one. How can the low incidence populations for whom it is most difficult to conduct research and collect evidence, how can we make sure that we're not getting lost and that that we're not seeing policy made that is necessary simply because it's very difficult to have evidence, or the evidence, which oftentimes by evidence it means cost effectiveness, right? It's a euphemism for cost effectiveness. When we're a population that's expensive to serve, how do we make sure that this move to evidence-based policymaking reflects, for example, evidence of improved quality of life, evidence of things that we really value, and that we don't get lost when the common denominator is usually a dollar value, and we're hard to research.
I will say that one possible place is that database, and being very clear about the outcomes that we're talking about within that database. And being clear about how we structure that to say, when we're saying this program works, what is it doing? Are we talking about the people? Are we talking about the money? Are we talking about, the context of the program operations? What do we mean when we're saying that it works? So I think that setting up that database very clearly is going to be important for the things that you said.
I also think in legislation, along with setting up the evidence stuff, Congress could afford, there are like findings, and I forget what the other like front matter things are, but you could say what your expectations were of what this program was going to accomplish in a fairly concrete way. And to me, that would be then helpful when evidence is produced. Well, evidence of what? Is it evidence that shows whether or not this thing met Congress's intent or expectations?
Yeah. And I think you bring up a really good point, which is a huge part of this is making sure that this sort of strive to build evidence doesn't outpace the focus on what the outcome should be, right? And so there are a lot of programs where the outcomes are a little more process-based right now, number of classes taught or brochures handed out or people visited or things like that. And I think that's where Congress needs to spend a lot of time too, is really trying to say, when we say we want to, provide food assistance, what are we trying to do? Are we, is this a measure of hunger that we're trying to satisfy, or is there a poverty line we're trying to get people above, or is there an employment rate we're trying to hit, or what is that metric? Because you're right, if we focus on the wrong metric, you can have evidence showing something's cost effective, right? Or it's reducing use of some service, but maybe that service is really useful and people need it. So that I think deserves the same type of attention as this as well.
Yes, ma'am.
Hi, thanks for the second question. Stacey Bridges, Veterans Vision. Question and a comment. First of all, I was always taught at American University to stick to the KISS method, keep it simple, stupid. And this little flyer that the Bipartisan Center came out pretty much summed up the whole report. That brought me to my next question. You said the least feasible things that could happen to make options for improving the use of evidence-based was number 5, 12, and 17 of page number 5. Increase resources for existing legislative support, provide congressional research services with resources to conduct systematic evidence reviews and conduct portfolios review and to support broadband. This is the least feasible, okay, these 3. Is there any way we can make these highly, most likely to happen? If it's least feasible, will this actually be more helpful to implement these things, or it's just sort of like a waste of time, do you think? Did that make sense?
I'll defer to the authors of the report.
I thought I was done. Okay, so I'll just say, and I'll defer to my colleagues here as well. I think on those feasibility assessments, it was sort of a broad sense of how kind of, in part, how possible we thought these were. If they involved a substantial commitment of resources, for example, or there were big institutional changes that would have to be made. Saying that it wasn't feasible didn't mean that it wasn't a good idea. That's not a measure of the effectiveness of it so much, or the value of it. It's just in sort of in an attempt to sort of give a sense of what's as Dan said, the low-hanging fruit versus the things that might take a little more effort or that might be a little bit more politically difficult to carry out. It's not whether they're effective or we don't think they're great ideas. We think everything in there is a great idea. But that's just sort of how to take that feasibility assessment from our perspective. Any of my colleagues wish to add to that? No? So, anyway. But I'm glad you like the table and find it useful.
We have time for about one more question, so you get a second bite at the apple.
Hi, I'm Samira Daniels. I just wanted to push back on some of what you're saying, and it's this. I've been following the Professor Tetlock's super forecaster and expert political judgment and the IARPA programs in the government, which are to improve intelligence. And, you know, there's some lessons learned from that about what is evidence. And it boils down to, you know, how do we think about things? And I cannot see, you know, such a fantastic idea as your, you know, the program and effort that you're suggesting, some incorporation of this critical, some kind of training of critical thinking to staff people. And this is, to me, in all the years that I've come up here in different, you know, situations, the staff sits back and, you know, sort of absorbs things. And I think that it's this critical, the quality of the evidence is also the issue, as you're suggesting. But that can't, you know, the staff is not in a position really, as you yourself are suggesting, to make those assessments. They need training of some sort. And this would be a force multiplier if you can somehow incorporate that. This is not a matter even of low-hanging fruit, because that's going to take, you know, you even said yourself, it's incremental, and it is incremental here. So I'm wondering, you know, if you could, you know, in your follow-up or even during this, incorporate some of this, the lessons that are learned from some of these larger projects that the government has initiated for now 7 years. And I think it's going to be critical to your success of this venture.
I think your comment reminds me of I was at a government evaluators meeting. This is like a, I think some folks from GAO, I think it was actually at GAO, it was like evaluation shops across the government. And we were talking about some legislation we were working on. We were talking specifically about a What Works clearinghouse and sort of the idea of evidence and focusing on results. And someone, you know, had kind of been, this was like hundreds of people, and I didn't realize, this was all across the government, there's lots of people. And sitting in a panel, sort of going through this, and there's this person you can see who's just kind of getting a little more frustrated. They finally raise their hand and say, well, how much training do congressional staff in like quantitative methods and analysis and all this stuff, how much do they get when they start, you know? And it was just like, wow, okay, like, no, they don't. Some do, some have this background, and we have some people who are, you know, PhD researchers that come to work on the Hill or former, you know, doctors and all sorts of things. I mean, we have a fellow in Senator Hatch's office right now who's an ER physician. So, I mean, we've got some people who are really specific and focus on a certain area, but I think you highlight a good point, which is trying to find that balance between, you know, in some cases that I work in, there may be a specific policy that I'm working on for a number of years where me and the other staff sort of on the Republican and Democrat side really can get together and spend multiple meetings going through evidence with folks. So there are those sort of landmark big changes where that does happen. I think the tougher issue is when you think about all the staff coming into a personal office and meeting with the legislative assistant and providing this information. I think some of it is, this is partly why you see these coalition efforts. You see the association of something, right? And they're sort of like presenting their position because they've consolidated their views into one sort of product for that discipline. And so I think that can be effective. But it is that balance, because I really don't feel, and I think you reiterated this too, that we just want staff of members to be given all the reports and sort of, you know, weigh them on the scales and determine what the policy should be. But I think there's ways to make it easier to translate to those folks. There's ways to bundle that either through support organizations or outside groups, and again, to sort of provide that nudge in one direction or another. But it's a continual balance, because some staff really will have the time and the interest in a specific area to dig really deep into a policy and go around the country and meet with everyone and bring in a panel of people to testify in a hearing. So it does happen. But I think we need to think of gradations of that all the way from sort of one page and a summary of what's going on to the sort of like multi-day type meetings and things like that, because it's a tough deal issue.
The only thing I would add to that is the sort of saving grace, whether staff are trained critical thinkers or not, is if you're hearing from a whole bunch of people, you are likely to hear a whole bunch of different things. And so and your job is to try to sort that out. I mean, we always at CBO encourage all the staff to treat anything they're told with a healthy degree of skepticism. And I think it doesn't take very long or very many meetings where you hear two diametrically opposed things about the same issue from someone before you do start having that skepticism. And also through the process of being told something one year, having legislation to go into effect, seeing what happens, and you start realizing it's not all so simple as it's sometimes presented. So I think staff, even staff that may have come from a totally different discipline, I mean, almost everybody has some degree of critical thinking, but I think you can't help as you go through life on the Hill gaining experience, at least. But it doesn't necessarily train you on what the best methods are that you should really pay attention to.
Elena, did you want to follow up? Or?
I think it's been covered.
Well, on that note, we are coming toward the conclusion of our program today, but I wanted to give our panelists the last word. So are there any key takeaways that you would like to share with the audience today to think about in terms of the paper, or did we miss anything, overlook anything? Is there anything for a volume 3 that you think that the Bipartisan Policy Center should be looking at? So I'll start with you, Elena. Thank you.
Sure. I was just, I was encouraged by the content of the report, to offer these options and, to let to me, this kind of signals maybe to the scientific community some things that may, be coming up and some ways that we can be looking on the horizon to support this evidence-based effort and to be prepared to, continue our efforts. Part of the, American Association for the Advancement of Science, so of how we can, continue to insert science. So as a researcher, I'm, heartened by this report.
Thank you. Holly.
Well, I would say, I continue to believe that focusing on ways to make it easy is the most likely way to make progress on this front. And by making it easy, I mean assisting staff in having a common language and a common perspective to review things like databases that show good examples and collect them in one place that's easy to find, and the idea of routinizing, if you will, some goals and evidence collection in the process of authorization. I do think there's one thing we haven't talked about very much, or which is that there needs to be, I think, more energetic follow-up on the prescriptions sometimes put into legislation. I remember almost any piece of legislation that comes through requires this, that, and the other report. But then sometimes later, next time I'm trying to do a cost estimate on that topic, I go look for that report. Well, it never seems to have been produced, or it's still in review somewhere. I mean, the lag between when something was due to Congress and when it actually arrives and what the quality of it is when it arrives, and I'm really not dissing the executive branch because they have a lot of competing priorities. There has to be some attention paid, I guess, to the evidence Congress has asked to have produced. And that's, again, gets to the making use of evidence more routine, creating space in the legislative cycle for consideration of evidence where there's time to sort of, in a focused way, ask people where the heck is the report they were expecting. So I do think that's very easy to say. and there's a lot of competing demands.
Ryan?
I think that point about follow-up, I want to build on that because some of the most productive meetings I've had, and the ones that staff and members are most receptive to, is when legislation has passed a number of years ago and people come in and say, okay, this was the intention, and then here's what's happened. And here's how we can make sure this intention is better met. And so you're already you don't have to cross that bridge of why do it or how do it because it's already been enacted. It's more about that course correction. And so you already you can sort of restart the old coalitions that supported it before. You can get better information on what's going on. There's sort of a built-in political will, and you can change the course a little bit and try and find, use the new information to inform the version 2.0 or 3.0 of whatever this program is. So I know that's one that's been really effective. And then lastly, I know I've said this a number of times, but I really, I think this report has been great, and I'm glad that the focus is, not so much on having the staff and the members be the total arbiter of the evidence, because I feel like both for capacity and other reasons that Congress can be great in helping to set a framework where that can be used in an orderly way. But I don't think we want to have each decision reaching a point where staff or members have to weigh all the competing evidence and make that decision, but setting more frameworks for those things to happen.
Well, with that, I'd like to conclude the panel discussion here today and thank each of the panelists for your efforts and preparation. In preparing for this, I said that we have a hard stop at 3:55, and congratulations, we made that just in time for.
Yeah. Well, first, thank you, the audience, for being here, sticking in with this, and thank you, Dan and Elena and Holly and Ryan. Thank you for your public service too. I think there's a little bit of discussion here about public service, really getting people involved in participating and working on the Hill for 25 years or whatever. Thank you, Sandy, Tim, Nick, Daniel, if you're here. I want to also give a shout out again to the Arnold Foundation. This has been a report. I'm glad you liked the report in the term of the simplification. I'll take that back to the boss. This has been a labor of love for BPC staff, I can tell you. And I don't think when I wooed Sandy out of retirement to take on this project that he or I realized how long this was going to take to get it done. So it's been a real labor of love, as I say. So thank you all for coming out this afternoon, and thank you, I hope, for helping us to keep up, all be champions of evidence and improving the culture of evidence in the Congress going forward. Thank you. Good day.